The peer support centers are part of the Prevention and Early Intervention component of the Mental Health Services Act. The goal of this component is to help counties implement services that promote wellness, foster health, and prevent the suffering that can result from untreated mental illness. The PEI component requires collaboration with consumers and family members in the development of PEI projects and programs. MHSA General Standards. Collaboration. The Harbor on Main regularly engages with community partners to share information, resources, and services for TAY youth and their families, such as sexual health and reproduction education, sexual assault and intimate partner violence crisis services and education, parenting classes and support groups, medically related transportation assistance, financial literacy, as well as connections to eligibility benefits and services like Supplemental Nutrition Assistance Program, Medi-Cal enrollment, CalWORKS, TANF, etc. Client-driven. The Harbor is a youth-led, youth-designed resource center with a welcoming environment where youth feel safe, participate in service learning opportunities, access technology, and find basic resources such as food, clothing, water, and hygiene supplies. The Harbor builds relationships with an average of 53 youth monthly using positive youth development, a framework that is focused around building protective factors to reduce risky behaviors. Harbor activities and programming are developed and determined by consumers in bi-monthly youth board meetings, requests to our suggestion boxes, and focus groups. Family-driven. The Harbor's programming is designed to meet the unique needs of the TAY population and their families by utilizing the Family, Voice, and Choice approach. Family and youth perspectives are intentionally elicited and prioritized throughout their engagement at the Wellness Center. Planning is grounded in family members' perspectives, and the team strives to provide options and choices that reflects the family values and preferences. Harbor staff intentionally focus on meeting families where they are at, using strength-based, person-centered approaches to motivate engagement while empowering youth and families to be the agent of change in their own lives. Cultural competency. Policy prohibits unlawful discrimination based on race, color, creed, gender, religion, marital status, registered domestic partner status, age, national origin or ancestry, physical or mental disability, medical condition including genetic characteristics, sexual orientation, or any other consideration made unlawful by federal, state, or local laws. All such discrimination is unlawful. RCS is committed to compliance with all applicable laws providing equal access to services. This commitment applies to all persons involved in RCS operations and prohibits unlawful discrimination by any employee of RCS, including supervisors and co-workers. Services provided by the Harbor on Main are designed to effectively engage and retain individuals of diverse ethnic, racial, cultural, and linguistic populations, as well as utilizing the strengths and forms of healing that are unique to the individual, the family, and their culture or community. Wellness, recovery, and resilience focused. Programming and services at the TAY Center are designed to empower youth through building social connections, increasing education, reducing stigma and discrimination, by promoting accountability and self-determination. A significant number of youths accessing the TAY Center are not having their basic needs met. Resources to meet these acute needs, such as food, hygiene supplies, clothing, and transit passes, allow consumers the opportunity to look beyond day-to-day survival and focus on healing and progress. When our consumers are fed and clothed appropriately, they are better able to focus on other aspects of their recovery. The Harbor hosts a variety of formal workshops and informal support groups that build resiliency and promote wellness in a collaborative and social environment. Integrated service experiences for clients and their families. TAY and their families who access the Peer Support Center are frequently concurrently enrolled in other programs or accessing services provided by multiple agencies throughout the county. The Harbor on Main coordinates with behavioral health, healthcare providers, housing programs, substance use programs, and other social service providers to bridge the gap between the services offered at the Wellness Center and to meet the unique needs of this consumer population. The Tay Center also provides on-the-road services at local schools and through community events to increase their reach to consumers and their families. The pillar of each center is peer support. Peer staff members with lived experience serve both transition-age youth and adult consumers and provide access to clinical services, peer support, socialization, and companionship. Staff routinely attend cultural competency trainings. Bilingual interpreters are accessed when needed. Underserved populations, such as people experiencing homelessness and those afflicted by substance use, are treated in a non-judgmental and respectful manner. Harbor staff pay careful attention to cultural, linguistic, and age-appropriate approaches, as well as helping youth develop and self-manage their own approach to wellness and empowerment. The Harbor on Main has made several adjustments to marketing and outreach materials to improve their reach of Tay youth and underserved populations in Lake County. Marketing materials are distributed in both English and Spanish and are distributed through various mediums, including virtually through list shares, social media, and press releases. Timely access to services is achieved the moment a participant walks through the doors of the center. Youth have immediate access to resources to meet their acute and long-term needs, including food, hygiene products, clothing, and referrals for services. Throughout the 2021 fiscal year, the Harbor was greatly impacted by the COVID-19 pandemic and shelter-in-place mandates. This forced the Youth Resource Center to adjust their approach to providing youth access to services and resources. The most notable success throughout the last fiscal year was the creative method in which the Harbor attempted to reach youth and the community at large. While the Resource Center was closed for drop-in services for approximately half of the year, the Harbor continued to provide virtual, on-the-road, and one-on-one services in alignment with the CDC guidelines and regulations, with approval from RCS leadership. When the shelter-in-place order was implemented, the Harbor was forced to close down to the public. However, the Harbor was able to continue facilitating these classes via on-the-road services at the Tay Family Stabilization Program. Since this cohort was considered a single household, the Harbor was able to continue to provide learning opportunities on-site at the residential facility. In an effort to reach Harbor youth not enrolled in the NEST program, courses were shared virtually via social media platforms such as Facebook and Instagram. As restrictions became reduced, the Harbor continued to make adjustments to meet the needs of their consumers. These adjustments included limiting the number of people allowed in the center at one time, provision of PPE, social distancing, frequent and routine sanitizing, as well as parking lot services. Parking lot services were designed to meet the acute needs of consumers, including, but not limited to-go meals, hygiene products, transportation assistance, water, clothing, and referrals to services. Staff consistently promoted virtual services and provided easier access to gain support through our social media sites. Further lessening of restrictions allowed the Harbor to resume in-person services within the center with continued emphasis on sanitization and safety. While consumers were still required to wear PPE and monitor their symptoms, the Harbor was able to provide hybrid services, in-person and virtual. Youth quotes. The Harbor is a really good place for helping youth get out of their shell and helping them become who they want to be. Before I came to the Harbor, I could not talk to people my own age, and look at me now. I'm talking to all kinds of people and leading the youth board. Kayla C. The Harbor is an amazing and fantastic place. They helped me find a job. Megan L. Similarly to the previous fiscal year, the key challenges of the 2021 fiscal year are related to the COVID-19 pandemic, the mandated shelter-in-place orders, and local public safety power shutoff events. These experiences adversely impacted the Harbor's ability to reach and serve Tay youth in Lake County throughout various periods within the fiscal year. Mandated closures forced the Resource Center to consider alternative methods of engagement, which included online virtual services through our social media accounts and via Zoom. Social media sites were updated with automatic responses guiding youth towards resources for mental health crisis if they needed immediate assistance. Sites were also updated to include opportunities to make an appointment to meet with peer support or gain access to other resources. The Harbor made several adjustments in the method in which they deliver services to ensure that consumers had access to the resources they needed. While they saw a significant decrease in access to the center, they saw incredible growth in social media outreach. Between July 1, 2020 and June 30, 2021, the Harbor's Facebook page reached over 13,000 people, which was a growth of 124% from the previous year. They also started their own Instagram, which saw a 100% growth in reaching followers. The overall goal of the Harbor is to increase safety, well-being, and self-sufficiency to ensure a successful transition to independent adulthood for transition-age youth, ages 16 to 25. They aim to achieve these goals by providing the following key services and activities: peer support, community outreach and engagement, and targeted support groups. The Harbor did experience the adverse impacts of the COVID-19 pandemic and mandated shelter-in-place guidelines during the fiscal year 2021. These mandates required the Harbor to be closed for drop-in services. The Harbor anticipates that they will continue providing virtual or hybrid services throughout the next fiscal year in response to ongoing and ever-changing shelter-in-place mandates. Because it is difficult to predict when these mandates will be lifted, the Harbor is exploring additional venues and opportunities to expand their service reach during this challenging time. They anticipate that the changes to these services will greatly impact their service numbers and ability to collect important client demographics to report, though they hope to see a greater number of consumers served in the upcoming fiscal year. The Harbor provides a milieu of services to address the aforementioned identified negative outcomes, including those to meet acute needs like transportation, clothing, food, and hygiene, which reduce the potential for long-term suffering, school failure or dropout, suicide, unemployment, and even homelessness. The Harbor has a direct connection to residential programs and shelters to address homelessness. They also facilitate life skills classes, support groups, and parenting classes, which all reduce the potential for Tay to become or continue experiencing homelessness, suffering, school failure or dropout, suicide, and unemployment. The Harbor also provides referrals to substance use disorder programs and domestic violence shelters. Client demographic and service data is collected via daily sign-in sheets, group attendance logs, and service tracking. These indicators were entered into C&F Data Portal. The system does not allow for custom forms or reports, which means we were unable to track and report outcomes effectively. The Harbor is seeking guidance and exploring alternative options to meet this data reporting requirement in the next fiscal year. At this time, they do not have the ability to track referrals and outcomes when they are sent outside of the agency and resource center. The Harbor can and will track their outgoing referrals in the next fiscal year. The Harbor on Main served a total of 127 individuals in fiscal year 2021. Of those 127 served, 8 were children 0 to 15 years of age, 60 were Tay 16 to 25 years of age, 47 were adults 26 to 59 years of age, and 12 were older adults age 60 or older. The Harbor on Main served a total of 127 individuals in fiscal year 2021. Of those 127 served, 12 identified as American Indian, 1 identified as Black, 76 identified as white, 34 identified as some other race, 1 identified as having 2 or more races, 3 did not report their race, 23 identified as Hispanic or Latino, 77 identified as not Hispanic, 14 identified as Mexican, 10 reported multiple ethnicities, and 9 did not report their ethnicity. The Harbor on Main served a total of 127 individuals in fiscal year 2021. Of those 127 served, 76 were born female, 46 were born male, 5 did not report their birth gender, 76 identified as female, 46 identified as male, 4 identified as non-binary, and 1 identified their gender identity as other.